Fundamental hematology principles. Blood composition. Whole blood includes erythrocytes, leukocytes, platelets, and plasma. When a specimen is centrifuged, leukocytes and platelets make up the buffy coat, which is a small white layer of cells lying between the packed red blood cells and the plasma. Plasma is the liquid portion of unclotted blood. Serum is the fluid that remains after coagulation has occurred and a clot has formed. Plasma is composed of 90% water and contains proteins, enzymes, hormones, lipids, and salts. Plasma normally appears hazy and pale yellow, containing all coagulation proteins. Serum, on the other hand, normally appears clear and straw-colored, lacking fibrinogen group coagulation proteins. Basic homeostasis. Homeostasis is the body's tendency to move toward physiological stability. In vitro testing of blood and other body fluids must replicate exact environmental body conditions. These conditions should include the following. Osmotic concentration is the body or cellular water concentration, composed of 0.85% sodium chloride. This normal osmotic concentration is termed isotonic. In a hypotonic solution, where there is a greater amount of water in relation to a lesser amount of solutes, water enters the cell, causing it to swell and possibly lyse. In a hypertonic solution, where there is a lesser amount of water in relation to a greater amount of solutes, water leaves the cell, and the cell may crenate. The pH reference range for venous blood is 7.36 to 7.41, and for arterial blood, it is 7.38 to 7.44. Normal body temperature is 37 degrees Celsius. Blood specimens should be analyzed as soon as possible to prevent cellular breakdown. Refer to individual tests for specimen collection requirements, stability times, and storage temperature. RBC indices. The mean corpuscular volume, or MCV, has a reference range of 80 to 100 femtoliters. It indicates the average volume of erythrocytes. You calculate it using the hematocrit and RBC count. An increased MCV can be seen in megaloblastic anemia, hemolytic anemia with reticulocytosis, liver disease, and in normal newborns. Conversely, a decreased MCV is found in iron deficiency anemia, thalassemia, sideroblastic anemia, and lead poisoning. Next, we have the mean corpuscular hemoglobin, or MCH. Its reference range is 26 to 34 picograms. It measures the average weight of hemoglobin in individual RBCs. You calculate it using the hemoglobin and RBC count. An increased MCH is seen in macrocytic anemia, while a decreased MCH is observed in microcytic hypochromic anemia. Lastly, the mean corpuscular hemoglobin concentration, or MCHC, has a reference range of 32 to 37 grams per deciliter. It measures the average concentration of hemoglobin. You calculate it using the hemoglobin and hematocrit values. A normochromic RBC indicates an MCHC of 32 to 37 grams per deciliter. An MCHC of less than 32 grams per deciliter indicates hypochromic RBCs, typically seen in iron deficiency and thalassemia. An MCHC greater than 37 grams per deciliter suggests a possible error in RBC or hemoglobin measurement, or the presence of spherocytes. Other RBC parameters. The RBC distribution width, or RDW, has a reference range of 11.5 to 14.5%. It is determined from the RBC histogram and increases proportionally with the degree of anisocytosis, which is a variation in size. A high RDW can be seen post-transfusion, post-treatment with iron, B12, or folic acid therapy, in idiopathic sideroblastic anemia, or in the presence of concurrent deficiencies like iron and folic acid. Next, the hematocrit, or HCT, has a reference range of 41 to 53% for males and 36 to 46% for females. The reference range for hematocrit is age and sex dependent. Hematocrit represents the percentage of RBCs in a given volume of whole blood. The spun microhematocrit is the reference manual method, where the buffy coat layer, consisting of leukocytes and platelets, can be seen between the plasma and RBC layers. Hematocrit is also calculated by many automated cell counters using the MCV and RBC count. Platelets. The reference range for platelets is 150 to 450 times 10 to the 9th per liter. The mean platelet volume, or MPV, has a reference range of 6.8 to 10.2 femtoliters. The MPV is analogous to the MCV for erythrocytes. Hemoglobin, or HGB, has a reference range of 13.5 to 17.5 grams per deciliter for males and 12 to 16 grams per deciliter for females. Like hematocrit, the reference range for hemoglobin is age and sex dependent. Relative and absolute blood cell counts. The relative count is the amount of a cell type in relation to other blood components. For example, relative lymphocytosis is an increase in the percentage of lymphocytes, often associated with neutropenia. In relative polycythemia, RBCs appear increased due to a decreased plasma volume. On the other hand, the absolute count is the actual number of each cell type without respect to other blood components. Absolute lymphocytosis is a true increase in the number of lymphocytes. Absolute polycythemia is a true increase in red cell mass.